Hey, this is Brandon Steele with Kyro-up. I've had many conversations over the last couple months to maybe even a year on AI with providers across, quite honestly, different countries. And it's not been positive. It's been met with fear and resistance. And I want to address that today because I have a different point of view, and I hope I can at least relay that point of view and provide a positive outlook on how AI is really going to help us and how Kyro-up is harnessing AI to help the profession. Now, when it comes down to it, you're not smarter than AI. I'm not smarter than AI. We never will be. That's okay. We are better at diagnosing musculoskeletal pain. I think we always will be. And there is no front runner right now in AI and developing diagnosis and treatment strategies. There are great evidence-based chiropractors doing that now, and they're only going to get better. We're better elucidating the intricate balance of anatomy, physiology, and quite honestly, psychology of a patient. As a portal of entry provider, who is better to recognize and alleviate symptoms associated with pain than us? And the blog that I just wrote and this video is designed around the strategies you can use and also strategies and functionality that Kyro is developing now to help us use AI, not to replace us with AI, to help use AI both in patient interactions, the treatments you provide, and also advice on daily living that we can help get patients better faster. And I think that AI is going to help us physically in clinic and physically for our patients. And I think that if we use it right, it's only going to help the profession. So saying you're never going to use AI in practice, I just don't think is true, whether we like it or not. It's like saying an insurance company is never going to use data to generate denials. We know that's not the truth. We're in a data-driven world. The question is, where do we get that data from? Where do we get the information from? Can we use Google? Can we use research papers? Can we use books? Can we use seminars? Yes, and that's what AI uses, but we need a standardized data set in order to pull that information from. Otherwise, we're comparing apples to oranges. Or sometimes, when it comes to patient diagnosis and treatment, apples to a fruit salad. So there's a question that we want to answer, is that will AI help the chiropractic profession or will it hinder it? Now, I don't have that answer right now. However, I can tell you it's going to require change. And there are some people who don't want change in their practice. Those are the people that when electronic health records came out, they just said, I'm done. When COVID came out with new rules and regulations, they just said, you know what, I'm not going to comply with that. I'm done. But for those of you who want to stay in the profession and want to keep up with what's happening as far as technology, AI is going to be a part of your future. The good news about this is that when it comes to sprains, strains, degenerative changes, disc problems, if you want to make an accurate diagnosis, especially in the face of chronic conditions, the most sophisticated AI models don't work. They're highly subjective data sets and the information they're pulling from the patients isn't correct. We need a way to create better data in order to get better answers from AI. And that data comes from the interaction you have with your patient, knowing when to ask questions, when not to ask questions, and then having the ability to, in the judgment, to accurately take those symptoms and match it to a diagnosis or a treatment strategy. To address this, Kyro-up has developed a chief complaint survey to get that data. That what we know is that if you can ask tailored inquiries based on the region of complaint and the symptoms, we now know how to lead a patient down a questionnaire to say, what are really the questions and information I need from this patient? And it's going to be important to not only get the right functional disability index, to ask red and yellow flags and provide alerts to the patient if certain questions are answered positively. This is something that can be done within 3 to 4 minutes. It's going to help get that standardized data in your hands to help you make the best decisions for your patient. And despite medical data, despite research articles, despite all the information out there on Dr. Google, These AI algorithms are not great at getting and finding these gaps in data to get the right set of diagnoses and data sets, which is why AI is not working well now. We think it's going to work better in the future if we can just feed it with the right information. So pretty excited about that. With our EHR functionality, we're going to be able to not only take that standardized data that's coming in from the patient, but we're also going to be able to match it to the outcomes. To say, for this pattern of intake, we're now going to be able to say, here's the normal diagnoses that are made, here are the normal treatments that are delivered, and here's the results that patient gets. By synthesizing the data with like-minded providers, we're going to be able to better diagnose, treat, manage patients across the board with musculoskeletal conditions. So if we can feed information into these systems and we can have the right systems, it's going to help us as providers make better decisions for our patients. And also understand that we're in a multidisciplinary profession, that if something is maybe smelling or looking different than something we're able to treat, how do we actually get that person in someone else's hands to help alleviate those symptoms? So understanding that uncertainty in care is something AI will never do. It doesn't like one diagnosis, but how many of your patients have layered syndromes and chronic pain where they have multiple things going on at one time? These are the reasons why we have a future in healthcare, and a big future. There is one question that comes down to individual preference and also the leaders in our profession, and that is, are we willing to remain in our own fairyland? Are we able to keep our egos high doing what we've traditionally done? Or are we going to stick our head out there? Are we going to say, you know what, let's let the data speak for itself. Let's compare apples to apples. Let's get a standardized set of data and say, hey, for this condition, with these symptoms, here's what I did for the patient, and here's my results. It's going to show the world that for non-surgical, non-pharmacological care, we're it. So the question remains, which will be solved in the future, are we better and are we more cost-effective and efficient than other healthcare providers? And I believe the answer is yes. That's why I love being a chiropractor. I love solving problems. And I think that AI is going to help us and catapult us and change the perception of our profession in the future. The question is, are we willing as a profession to do the changes, to incorporate the softwares, to make sure that we have a seat at the table in the future of healthcare? And the answer is going to be yes.